How many grafts will I need to fill in the temple area? I do understand that the hair loss would worsen over time. Just curious, how many grafts will I need to fill in the temple area? I do understand that the hair loss will worsen over time, but I'm just curious how many grafts I will need now.
Thank you for your question. You've submitted some photos and you're asking about how many grafts you need to fill in the temple area, and you stated in your question that you know you'll lose more hair, but you just want to know how many grafts you'll need to fill in the temple area. Well, I could certainly help you with this. I'm a board-certified cosmetic surgeon. I've been practicing hair transplant for over 20 years, and I'm also the founder of Tricostem Hair Regeneration Centers, which is a non-surgical solution for hair loss, which I will discuss in the context of your question. Now, it's very good that you at least realize that your hair loss will continue. And this, when you start asking about questions about numbers of grafts, you really go down a vortex. And there are some physiologic realities that you have to understand before you move forward with any type of surgical hair transplantation. Let's begin with coverage. When you think about numbers of grafts, you have to understand that the donor area, the area where the hair is harvested from, is not bottomless. And so when people shop hair transplants, and hair transplants become such a commoditized field where doctors are offering sales on X dollars per graft, and patients are being misled into believing that it's all the same, and it's as an incentive to, quote, close the deal and just get the patient on the table. But what is not clearly communicated consistently is that this area, the back of the scalp, the area where the band of hair in the baldest man you've ever seen, is the limit of where you can get the hairs. So, in addition, you have to think, when you think of grafts, you also think of coverage. Hair has caliper. It has a certain diameter and thickness. The darker and thicker covers more scalp than finer and lighter. When we do hair transplantation, you can't really put more than like 20 grafts in a square centimeter. So when we do hair transplant, we actually draw the squares on the scalp to show how much area we're going to fill. Then from the donor area, we draw out how much we can potentially harvest. But very important to understand is that the coverage will probably require to look natural more than one transplant. A lot of doctors may claim they can put 50 or 100 hairs in a square centimeter, which technically may be possible. But from our experience, the diameter or circumference, I should say, of skin that you need for a graft to survive is still limits how many hairs you can put in a square centimeter. Now, for natural density, you need more like 40, 50 hairs per square centimeter, and that's why a lot of people are afraid of hair transplant, because people look, quote, pluggy. So even if people look good after a transplant, their hairs are never as close together as they are through nature. This, of course, has been a frustration for a long time. And now add to that you'll continue to lose hair, and you'll understand that the number of grafts and number of sessions and the longevity of the procedure are all very open questions. In our practice, what we perform is something called hair regeneration. We have been doing hair transplant for many years, and a few years ago we started developing a non-surgical solution for thinning hair. For areas which are smooth and haven't had hair for more than 3 to 5 years, hair transplant is still necessary to put hair in those areas. But majority of patients who came to see us were actually men who had active thinning. With hair regeneration, we do an injection that results in a reversal of the hair thinning. Any hair that's thinner appears to grow back thicker. And this is using a wound healing technology called extracellular matrix. And we have had such good results with this that we've essentially significantly decreased the amount of hair transplants we do, and we're now creating centers where people can have this treatment as an alternative to transplant. We've actually have gone so far as to say that in the right candidate, the yield and coverage of hair regeneration will exceed 2 transplant procedures. So I think that one of the things that you should pursue first is stabilization, whether it's using finasteride or whether it is a technology like ours, hair regeneration. You want to maintain stability before you move forward with transplantation. And think about the future. Think about when you've been doing this for 20 years, you see how challenging it can be when someone's hair continues to thin and you run out of enough of hair to transplant. Even in the best technical, execution and with the use of wound healing materials like ACell or extracellular matrix, it's still a limited procedure. So learn more about stabilizing before you pursue filling in the temples, because you may be unhappy with the receding temple, but you'll be much more unhappy with a artificial looking or operated on temple. A lot of our patients who we've been able to treat in the temples actually get back a decent amount of hair and are able to fill in pretty nicely without a surgical procedure. So I hope that was helpful. I wish you the best of luck. Thank you for your question.